Welcome to the John Vincent Hair Loss Dossier podcast series, bringing to you all that is new and important in the world of hair restoration, including real facts and new developments from the luminaries in the hair industry. This series, like my book, focuses on new technology and valid treatment options that help women and men regain self-esteem and confidence. And just as important, it will debunk the myths about hair loss and bogus treatments that can actually be detrimental to one's physical and mental health, not to mention their wallet. Today's program focuses on how the internet can be a dangerous tool when searching for answers to hair loss. Our program is titled, In Search of More Hair, How Not to Make the Mistake of a Lifetime. Sam Daniels is an ordinary millennial who set out to solve his concern about going bald. Sam, not his real name, works in tech and makes a good living. He rents a nice apartment and hopes one day to have his own home and family. He socializes with his coworkers, and his hobbies include hiking, biking, and building furniture. In high school, Sam's buddies made note of his thinning hair, and he went along with the light-hearted humor aimed at him. Inside, however, he saw the follicular deterioration as a handicap to his self-confidence. Sure, other guys his age had to deal with the same issue, and many seemed to blow it off as inevitable. But Sam was proud of his looks overall. He maintained a sense of style in both his wardrobe and grooming regimen. Although it annoyed him, he kept a collection of hats and was rarely seen without one. This method, of course, limited him at social gatherings with his coworkers and friends where a head covering was out of place. As a result, he avoided certain events where he had to reveal his balding head. Of course, as is common today, a number of his friends with the same problem chose to make a statement about their own hair loss by shaving their heads and accepting the retreat of hair as inevitable. But Sam was not one who could accept the macho look. He became more and more introverted about it and went so far as to arrange his desk at work so no one could focus on the back of his head and its lack of coverage. Sam became depressed about his chances of meeting the right girl, as he felt, whether accurate or not, most females were attracted to guys with great hair. And let's face it, in the movies and in magazines, guys with great heads of hair are the leading men, while the bald guy is in the supporting role. Think of Seinfeld and George, for example. Of course, with a plethora of hair products that are advertised for hair loss, Sam spent more than a few dollars on treatments that promised a cure for baldness. But as most might only slow down the departure of his follicles, he realized he could never be content to have the look of anything but a full head of hair. As he searched the internet, Sam was made aware of the many clinics that offered hair restoration. He ruled out the hair club approach as he felt the possibility of discovery or the limitations that a hair system might result in would restrict his active lifestyle. In his research of well-publicized hair transplant surgeons, Sam was concerned about the cost of the procedure, that it could be more than he could manage. But he kept looking. The results of a ubiquitous brand that appeared on TV, in magazines, and online increased his desire to have the great results he saw were possible. He knew he was never going to feel complete until he solved this flaw in his appearance. Sam, like many of us today, believed better deals can be found on the internet. His search led him to become aware of foreign clinics that offered the same results as the well-known doctors, but for a fraction of the price. After narrowing his choice to a Middle Eastern clinic that portrayed amazing transformations and promised guaranteed low prices, because he felt he needed to do something, Sam booked a trip and put his trust in a company he hoped that his research had proved to be reliable. And unfortunately, this proved to be the biggest mistake Sam Daniels ever made. You see, many patients don't realize that there are primarily two types of extraction and placement techniques utilized in today's hair transplant surgery. The first method, and historically the most common, is called the FUT, or a strip extraction of hair-bearing tissue. This involves removing a section of scalp, dividing it into individual grafts of 1, 2, or 3 hairs that are inserted into the balding areas. The other technique, widely used by more recent students of hair surgery, is the FUE, or follicular unit extraction method, where small clusters of hair-bearing scalp are punched out and moved into sites made in the hairless areas. Both methods have their advantages, and the surgeons who are versed in both are most likely to provide the most efficient use and results of the precious and limited donor hair. As explained by Dr. William Rassman, a Beverly Hills-based pioneer of surgical techniques with more than 30 years of experience and innovation, and who is often called upon to correct unsatisfactory surgery results, much of the recent and less experienced surgery work utilizes only FUE methods. In his words, one that can limit a hair transplant to inadequate coverage. Dr. Rassman explains this and much more in my podcast, Don't Have Surgery, found on my Facebook website for Hair Loss Dossier. Getting back to Sam, because he had not done sufficient homework, he was unwittingly choosing a clinic that was versed in just the one method, one that utilizes technicians and often robotic machines to remove lots of grafts in a relatively short period of time. As hair is a precious and non-renewable resource, Sam overlooked that choosing a method that made the best use of his donor hair was critical to the long-term result. When he arrived at his appointment in Istanbul, Turkey, Sam was met by a driver and taken to a rather austere and bare-bones clinic. He rationalized that because of the lack of frills of a more ostentatious brand, the prices could be lower. His enthusiasm, however, took a hit when he finally met with a salesman at the clinic. Although this person was billed as sort of a concierge, he was far from any medical professional that Sam had ever dealt with. The salesman first confirmed that providing the advertised number of hair grafts, some 6,000, needed to provide a full head of hair would be assured. The cost, approximately 1/10 of the amount quoted by doctors at home, was paid up front. And it was with an unwarranted belief that the outcome would finally solve Sam's discomfort of being the bald guy. It was, unfortunately, an unjustified leap of faith. See, what Sam failed to realize were the lack of regulations that many hair clinics outside the U.S. operated within, such as not requiring actual doctors doing the surgery, rather employing technicians to perform it. And most would require doctors and RNs to be the only ones that could introduce anesthetics. You wouldn't want your dental hygienist to inject Novocaine, right? These rules don't apply or are loosely followed in many third world countries. Now, it is, of course, human nature to not want to overspend for a major purchase. Also, unfortunately, all of us can be influenced by advertising that purports their product or service is better than another. And typically, the worst purchases we make can be returned or written off as a bad choice. However, for Sam and so many other victims of transplant tourism, the horror of a bad surgery choice can haunt a person for a lifetime. As Dr. Robert True, a renowned hair transplant surgeon in New York City, in practice since 1992, explains, these transplant tourism businesses are often provided by clinics where no surgeon is present. When there is a doctor present, he or she is often not trained in hair surgery or accredited by a recognized organization, such as the International Society of Hair Restoration Surgery. As we continue with Sam's story, You'll learn that hair restoration done right offers a lifetime of confidence in your appearance. And conversely, done wrong, transplantation can result in a lifetime of regret. And it's not to say that there aren't respectable, qualified hair restoration clinics in the Middle East. If the credentials of the surgeon and his or her staff is published, and a consultation with a doctor is performed in accordance with the governmental rules, the patient is more likely to be treated by a legitimate physician staff. If these rules are not followed and patients need to be careful, even in this country, the risks of any surgery are magnified. As we have left Sam in the office, let's get back to the fact that he was rightly uncomfortable with his experience. After several hours of much stress and discomfort, surgery is difficult for most patients in the best of circumstances, and undeniably worse if one is not able to converse with the staff. Sam was ushered from the office with his head fully bandaged and a supply of pain pills to ease his discomfort and transported to his accommodations, where he spent a sleepless night. He was brought back to the clinic the next day by an aide. His dressings were changed and his surgery inspected. He was told all went well and the healing would begin immediately, and his hair would grow in as promised. If only that were true. With a language barrier between he and his non-English-speaking custodian, Sam had little understanding of what he could expect during his recovery. On the return flight home, Sam's deepening sense of dread continued. His head was throbbing as if someone had punched 1,000 holes in his head. Well, they had. The wounds were slow to heal, and the results of his surgery would be under wraps for a couple of weeks at least. With his head fully bandaged, he was grateful no one on the flight from Turkey would recognize him and ask him embarrassing questions. With the pain of the extensive trauma to his head was deadened somewhat by painkillers, Sam traveled home in a daze. All the while, Sam tried to lift his own spirits, imagining how great life might be with a full head of hair. He fantasized that someday he will look back at the discomfort as being all well worth it. Back in his hometown, Sam made a stealth return to his apartment and focused on the post-operative instructions in the hopes all would turn out okay. The first couple of days of recovery were the worst. Discomfort and worry about the result, combined with his concern about how long it would be before he could return to work without undue scrutiny of his head, weighed him down. And of course, unlike the simplest post-operative procedures one would endure at home, there was no one to talk to. After a week, with his wounds not healing as quickly as he wished, and worried about permanent damage to his scalp, Sam made an appointment with his dermatologist. Ironically, one who would recommend he have surgery done locally by a accredited doctor. Sheepishly, he recounted his experience with a surgeon who prescribed antibiotics to control infection and ironically again referred him to a hair restoration specialist for evaluation. Sam was forced to extend his vacation days from his office as he nursed his wounds. He became concerned about how he would explain his appearance if healing was delayed even longer. As the skin recovered and the wounds healed, Sam noticed gaps in his hair where the donor hair that was removed and placed elsewhere were evident. He anticipated that it would take time for the newly relocated hair to grow in, but bare spots elsewhere were not what he expected or had discussed with his overseas clinic. To understand these gaps from his operation, the reader might not be familiar with a common complication from moving excessive numbers of grafts in one procedure. This result is called over-harvesting. It's a phenomenon that results where hair that is removed in mass, typically by those without knowledge and cosmetic skills necessary to limit the effect, can leave permanent openings in the coverage of what was previously a populated area. This is not good news for Sam, as he now faces the likelihood of much corrective surgery to undo the improper distribution of hair from the procedure. This certainly will be complicated and expensive, and the best outcome will leave the scalp with a normal appearance, although not one with the coverage he was originally promised. As Dr. Marco Berusco, an award-winning hair restoration surgery in Florida and past president of the American Board of Hair Restoration Surgery, is one of those who have been called on to fix bad work. He reports he and his colleagues are dismayed at the results they have witnessed from patients of foreign clinics. Dr. Borusco says, all of us in the ISHRS have shared horror stories about those coming back from foreign countries with complications and disfigurement from improperly planned and executed surgery. For those of us, he says, who have dedicated our lives to providing natural results, what we see makes us literally want to cry. For complete information about why we lose our hair, how restoration has evolved to an aesthetic science, read or listen to my book, Hair Loss Dossier, The Big Lie on the Causes, Cures, Treatments, and Scams, available on Amazon and other major retailers. For a personal consultation with me, write to John Vincent at hairconsultant.com. And thanks for listening.